Hi Dr Jha, how are you this morning?
I'm very well, thank you.
Dr Jha, I hear you do age spots treatments. Can you tell me a little bit about age spots?
Yeah, age spots are quite a vague term that common people use or lay person use. For a doctor, age spots means nothing. The doctor has to assess what the spot is, whether they are precancerous or cancerous spots, or they are just a benign lesion which is harmless spots. And there are various groups of spots occurring to various skin types. Say for example, I am brown skinned, and people who are the brown skin, they generally get brown spots on the face, very fine, small, say 2 to 3 mm size spots around the eyes, on the forehead, on the temples. They get these when they reach the age of 40. Generally all the age spots, they tend to affect people who are 40 plus. Younger people don't generally get any age spots, and that may be the reason why they are called age spots. Now, dark skinned people or African skinned people, you may have seen many of them have these quite rounded spots, flat warts sometimes, and they have a special name called dermatosis papulosa nigra. And they generally affect people who have got dark skin or black skin. White skin, on the other hand, they also get age spot when they reach 40 plus, and generally they get spots around the neck, around the chest, the trunk, back and front, and sometimes arms and so on. And they are classically called in medical terms seborrheic keratosis, which is quite a benign condition, harmless condition, but they look unsightly, and therefore they may have a cosmetic concern. They don't have to be removed, but of course they need to have regularly assessed by the doctors, and that they are safe to be left.
Wow, very good information, Dr Jha.
Thank you.
How are they best treated in your views?
Well, again, as I said, they have to be assessed by a doctor or a physician, and if the condition is very benign, harmless, then they can be removed by any way, either with a knife or with radiosurgery, or even with a laser. Of course, the laser that we use is, of course, tops the rank in terms of scar. This scar is minimal, possibly there is no scar, there is no pigmentary changes, and so on.
Is there also any harm if they are left untreated?
Well, some spots, especially sunspots, also called actinic keratosis, they should be treated. But other spots, once they have been seen by the doctor and assessed by the doctor, then yes, if the condition is benign, then yes, they can be left.
Wow, I think that is everything I wanted to know, Dr Jha. Thank you very much for your time.
Thank you, thank you.